Well, a new report suggests a significant portion of the cost of getting cancer is shouldered by patients and their caregivers. The Canadian Cancer Statistics Report finds patients and families pay 20% of Canada's total cancer costs, amounting to $7.5 billion this year alone. The burden is often worse in lower-income households because they may have less health coverage. Also, those living in rural and remote communities face higher costs for travel and necessary care. And joining us with more on this report is the Canadian Cancer Society's Stephen Piazza. Stephen, thank you for joining us. Look, ask any caregiver and they will tell you these numbers are not incredibly shocking. First, you or a family member gets hit with a cancer diagnosis. That is awful. And then you may have to grapple with the financial burden of it all. Tell us what you're hearing on the ground and what you're learning through the numbers.
Absolutely. I mean, what is shocking is the total sum that you would pay over the course of your lifetime. And this report found that people facing cancer can expect to pay about $33,000 in cancer costs over the course of their lifetime. And that breaks down into a number of areas. So it's about $16,000 worth of direct out-of-pocket costs, things you're paying cash or credit for. Right. And then about $11,200 in things like time lost when you could be doing other things. And then we have indirect costs, so about $5,600 for lost income. You know, a cancer diagnosis hits you at a time when all of these costs come and your ability to earn an income is severely diminished.
Right, absolutely. I think this is what stood out to me the most as well, beyond those shocking numbers. The financial constraints can contribute to worse health outcomes, with some opting to delay or forego aspects of their treatments. What did you think of that?
Yeah, it's really crushing, you know, when we total these costs of cancer care, because cancer impacts everyone, but it doesn't impact everyone equally. So if you're living on a lower income or you're in a rural and remote community, those costs are going to be a lot greater and impact you in a very different way, like foregoing treatment. You know, we believe that our country has universal health care. But then we look at the bill that comes with the cancer diagnosis and we realize that's really not the case in a lot of circumstances.
Yeah, cancer comes with an incredibly high price tag, as you're explaining to us, but you don't think it has to be that way. So are there any recommendations here or something that we can do to improve the situation?
This is a key point. It comes with a price tag, but it does not have to be this way. You could visit cancer.ca/cost-of-cancer, join our petition, and find out what we're calling for change. There's a number of things that the federal government could do, things like make the caregiver tax credit refundable, so that, you know, even after taxes owing, you have money returned to you to pay for some of these costs. Things like increase access and reduce costs for cancer drugs. Provincially, we could protect people's jobs so that when they take time off for treatment and recovery, they have a job to go back to. We could increase in this province access to take-home cancer drugs. So those are drugs that are taken outside the hospital in oral or injectable format. In Ontario, after you go through everything, private insurance, all of those things, you may end up with an out-of-pocket cost that wouldn't exist in Western Canada. So it's really making a lot of these programs and services universal and not having that bill depend on where you live in our country.
Absolutely. Stephen, this report was first of its kind, really taking a look at how cancer impacts families, as you noted, caregivers, that financial piece, and also how it impacts the healthcare system. Why was it so important to capture this data?
So when it comes to health system impact, we know that sort of patients and caregivers are shouldering about 20% of the cost of cancer, the health system shouldering the other 80%. And that amounts in 2024 to $30.2 billion. Now that we sort of have quantified the problem, we could really begin to focus on solutions and how to reduce that cost. So we've talked about how to reduce the cost for patients and caregivers. When it comes to the health system, we can make upfront investments in things like screening and early detection to find cancers early when they're easier to treat, and frankly, less costly to manage for the health system. So we could really start to make some of those investments as a health system to address this cost of cancer.
Okay, Stephen Piazza with the Canadian Cancer Society. Thank you so much for putting this into perspective for us. We really appreciate your insights.
Excellent. Thank you for having me.